BC set to become the first province to decriminalize small amounts of drugs, but with a hard limit of 2.5 cumulative grams. Many longtime drug users say that threshold means they won't be decriminalized.
2.5 is ridiculous. I think it's setting people up for failure, and I think as well, I need more than that to wake up in the morning.
Kevin Yake has been using drugs for 40 years. He says the threshold doesn't take into account the realities of drug use. Many users buy in bulk, and fentanyl is so fast-acting it forces users to quickly increase the amount they use.
The tolerance goes up, so you have to use a little bit more. So it's just that. You have to use a little bit more, you have to get a little bit more, you have to carry a little bit more, and that threshold number stays the same.
2.5 grams represents just over half a teaspoon. Now, BC had originally asked for the threshold to be 4.5 grams, but after consulting with law enforcement agencies in BC, the federal government decided that would be too high. Law agencies said around 85% of drug confiscations are for amounts less than 2.5 grams. The data varies across agencies and is complicated by the fact that some numbers include packaging while others don't. Vancouver police said it's too early to say how they'll enforce the limit, which comes into effect in January. That has users and advocates concerned.
How are police necessarily going to be equipped to eyeball that in the field? Second, does that mean that this might become a mechanism by which anything above that threshold gets understood to be potentially possession with the intent to sell?
I just see more money for the police and more headaches and more obstacles for the user.
The federal government says the threshold is just a starting point and can be adjusted. While it's welcomed by those who use and study drugs, it's seen as a half measure.
It's a step that falls far below what's needed and that isn't accompanied by the types of supports that people need to have to be safe.
Nearly 10,000 people in BC have died from toxic drugs since 2016. A tragedy the government hopes this new step, a first in Canada, can stop. Michelle Ghoussoub, CBC News, Vancouver.